So I have checked patient records. I just identified a male that needs to be catheterized. But first, before I go in there, I'm going to identify if I need any kind of PPE. He doesn't have any kind of contact or isolation precautions, so I don't need any of that. I'm also going to double check any kind of physical limitations. This patient does not look like he's had any kind of recent surgeries. I think he's just having some bladder retention, so we're going to go ahead and take care of that for him. So I'm going to go in there, I'm going to introduce myself, explain the procedure, and ensure the patient's privacy. So knock, 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 going to close the door, close the curtain. Hi, my name's Kayla. I'm going to be your nursing student today. I understand you already know that we have to give you a Foley catheter. So what I'm going to do is I'm going to go ahead and clean you up first. I'm going to cover you up with a bath blanket. Looks like you already got one, so it's great. But first, can you tell me your name and date of birth? All right. Do you have any specific allergies to latex or iodine? Okay, so you do have an iodine allergy. I will be sure to get rid of that. So I've got my wash basin. I've made sure the water's not too hot, not too cold. And I'm going to go ahead and start. So I'm going to put on my clean gloves after I performed my hand hygiene. And I'm going to put a waterproof pad underneath my patient. I don't have one, so for the sake of make-believe, it's there. So if the patient was uncircumcised, I would go ahead and retract the foreskin, and I would clean it, and then I would immediately put it back and then clean around that as well. But my patient is circumcised, so we're just going to clean it as need be. So we're going to go ahead and act like this penis is divided into fours like a pickle. So we're going to use a corner for each quadrant of the pickle or the water bottle. We're going to take one corner, we're going to go around the meatus, and we're going to go down, and then we're going to use another corner, and we're going to go around the meatus, and we're going to do the top of the right side. So now the top is done, but we're going to go ahead and flip our mitt, and we are going to go ahead and, whoa, my mitt's not working. There we go. We're going to go do the bottom side of the penis, and we are going to do the scrotum as well. So do the around the meatus and down into the scrotal area. Then we're going to do the fourth, and we're going to go around and down. So now that the patient is washed, we would pat dry as need. I'm going to go ahead and remove my gloves, perform hand hygiene, and remove any kind of materials that aren't needed for this next procedure. All right, so this is gone, performing hand hygiene. All right, so we are going to adjust your legs. I'm gonna take the waterproof pad that's out from under you away because it's already wet, and we're gonna replace that here in just a second, okay? I know this is gonna be uncomfortable, but we're gonna get through this together. So I have my sterile catheterization tray. So we're gonna go ahead and remove this. And I'm going to go ahead and keep this plastic bag for trash. I'm going to put it right here. Maybe. Okay. And then we're going to go ahead and open this in a sterile fashion, never reaching over our catheterization tray. So the very first thing I'm supposed to do is I'm going to don my sterile gloves. So minding my 1-inch borders, I'm going to open it, making sure, that the cuff is towards me. If this were a normal pair of sterile gloves, I'd start with the top flap, the bottom flap, and then I'd go for the middle, but we only have the middle flaps right now. So I'm going to go ahead and open these using the flaps. And then I'm going to start with my dominant hand first. And we're going to go ahead and insert palm up. And for demonstrating purposes, I am showing the camera. I'm not turning away from my sterile field. I'm going to fish my 2 fingers underneath the cuff, keeping my thumb out, and inserting my palm up. Now, if this were the time that I needed to do any kind of adjustments, I could, because I'm sterile to sterile, but I do not need to. So now that I have my sterile gloves on, I'm just going to go ahead and discard this and keep my hands above my sterile field. So the very first thing I'm going to do, this patient doesn't have any physical limitations, but for make-believe's sake, I'm going to go ahead and put this waterproof pad underneath him, airplane style, but then I will adjust because he is a stuffed animal. So, minding my 1-inch border, I'm going to open this away from my body. Try to avoid any manipulation that is not needed. All right, so the shiny side is towards me, so I'm going to flip that. All right, so this is the shiny side. I'm going to airplane under my patient. There we go. And this is the part where we ignore because he is a stuffed animal. Okay, sterile. All right, so now I could use a fenestrated drape to drape over the penis if I need to. I choose not to. I'm going to use this blue pad and I'm going to extend my sterile field. So I'm going to grab it by the corners, keep it away from my body, make sure that it is open, and it is, but the shiny side is towards me. So I'm going to flip it, and I'm just going to drape this and extend my sterile field. All right. Now my patient said he had an allergy to iodine. So the very first thing I'm looking at in my my catheterization tray is iodine. So in a sterile fashion, I'm going to go ahead and discard this in my garbage can. So now that that has been taken care of per the patient's safety, I am going to set up my catheterization process. So I'm going to take my tray and I'm going to put this between my patient's legs. And then I'm going to take my actual catheter bag and place it behind it. Now this is where I would grab my urine specimen cup, but my urine specimen cup is already over there with the label ready because I need to catch a sterile urine sample. So the first thing I'm going to do is I'm going to take the antiseptic and I'm going to drip it over my already fluffed cotton balls. So open this and we're going to put it on my cotton balls. And then we are going to discard. And then I'm going to open my lube. The catheter tube needs to be lubed 2 to 4 inches, so I'm going to put a generous amount on there. So we're going to go ahead and open this, put some on there, and then discard. All right, so the next thing I'm going to do is I'm going to take the tubing off of the protective cover off of the tubing of my catheter tube. Making sure that I'm trying to keep control. We do not want this flopping on the outside of the sterile field, or that will result in us having to start over. So we're gonna discard this. So I can see from here that it is clamped, so there's not gonna be any kind of urine collection problems. It's not going to be dripping out everywhere. So I'm going to set this catheter tubing into my lube. And now that that is done, if it will cooperate. Cooperation. Okay. Next thing I'm going to do is I'm going to uncap my syringe. And I'm going to discard of this carefully because I don't want to lose it. And I'm going to attach this to my catheter so that it is prepared for when I am done cleaning with antiseptic. So now I have decided, since I'm on the right side of the patient, that my left hand will grasp the penis and will not move. So I'm going to grab my tweezers or my forceps, whatever you want to call these, and I'm going to stabilize the penis, and I'm going to grab my cotton swab, go around and cut the pickle in 4 and go back to the scrotal area. Then we're going to discard over here to avoid crossing our sterile area. Going to grab this around the meatus down to the top, discard. We're going to cut the pickle in 4s at the bottom, so we're going to around the meatus and down to the scrotal area. And then we are going to do that one more time, and then discard. And then I'm going to take this last cotton ball, and I will wipe between the penis, the shaft of the penis, and the scrotum, just to ensure that it is clean. So now that I'm done with these, I am going to discard them. So I am now done. My hand cannot move. Now I'm going to insert the catheter into the penis. So I'm going to grab my catheter, and with a male versus a female, you insert this all the way to the junction of the Y. So I'm going to grab it. It is lubed 2 inches, so I'm going to grab it 3 to 4 inches up, and I'm going to start inserting it. Can you bear down like you are going to have a bowel movement, please? And then I would continue inserting. If I met any kind of resistance, I would twist the tubing instead of continue to push. We don't want to force the catheter. So now that I've gotten past the resistance, we're going to keep pushing. We're going to keep inserting the catheter all the way to the Y. Oh, plastic on plastic is so much fun. Okay, so now I'm going to stabilize it with my hand that has been on the penis. So this is when I would go ahead and inflate the bubble. So I'm going to use all 10 milliliters of the fluid. All right. And I'm going to remove that, and I can discard this in the sharps container or whatever my facility policy prefers. So sharps container. So what I'm going to do next is I'm going to catch my sterile catheter or my sterile urine sample. I'm going to attach it to the patient's leg so there's enough slack, but I'm also, before I do that, I'm going to tug slightly until I feel resistance. Should be about 2 to 3 inches, maybe a little more. And when I feel resistance, that is when the catheter has been in place. So I'm going to attach the catheter to the patient's leg, attach that to the bed, get my sterile urine sample. This is also when I would clean the penis again if there's any excess lube left over. Nobody wants excess lube on their penis, so we're going to do that. I'm going to clean up my workstation, put the patient in the lowest position, raise the rails, place the call bell near the patient, and I'm going to remove my gloves and perform hand hygiene, and I will come and check on my patient later.